We are live. Good, good, good. Okay, good morning, everybody. I'll do a sound check. Kent, how am I sounding? Okay?
Excellent. We're all set to go.
Good, good, good. We've got Dr. Vu as well.
Dr. Vu will have to
Perfect.
unmute himself.
Yeah, unmute. Perfect. Okay, so let's get started this morning. It is Wednesday. It's a beautiful morning here in California. And Kent and I are super excited. This morning, we've got a very special guest with us, Dr. Vu. Before we get started, I'd like to make a couple of announcements. One, there is no healthcare forum in Provo in July. And Scott Bennett and the leadership team, they'll continue to update us and, just trying to be as safe as possible. So we're hoping for August, but we don't know yet. So if you've booked your flights for July, which reminds me, I've got to change mine, make sure you postpone it till at least August. So, and then as a reminder, we have 3 wonderful training calls a week. John Whitaker does his Eagle Call on Monday. Of course, Kent and I do the Master Action Call, and then Lawrence does a fabulous call on Fridays, and I try to plug in as much as I can Liveline. If you can't plug in Liveline, I typically record our Wednesday calls, and then you can also look at it back on Facebook Live. So with that, I am going to welcome Dr. Vu to the call and open it up to Kent, and we'll get started. And then also, folks, if you'd like to put any comments or questions in the chat for Dr. Vu, feel free to do that as well, okay? So Kent, take it away, my friend.
Well, good morning. Thank you, Wendy. So a year and a half ago, Wendy and I got together and wanted to increase our business, do a better job of creating change with our scanner and this business that we educate in Healthcare Alliance. And one of the processes we've been talking about has been prospecting, onboarding, sharing the scanner, sharing that testing, the product lines, and the associated businesses. And one of the big questions we're getting, since we don't have a fly-in or a healthcare forum at the moment for teaching and educating, is, okay, what do you do? What do you do when you get a scanner? How do you proceed, educate, teach, and train? And I know John Whitaker and Stephen Moore and Scott, the leadership, have been putting together different programs, and will continue to do that. But what Wendy and I were talking about is thinking about who can we invite to demonstrate best the activity of moving forward with a scanner. And it came to light Dr. Vu, because from years, not that many years ago, but John Whitaker would use Dr. Vu as a wonderful example. And the time I spent with him, and Wendy and I spent with him at the A4M convention in Las Vegas and associated activities, he is one that grasped the power of the scanner, the technology, the associated nutrigenomic and epigenetic products, and integrated it into his practice. Welcome, Dr. Vu. If you could give us a little background on yourself, and we'll spend some time together.
Well, I am a family physician here in Little Old, Georgia, and my practice has evolved from a regular family medicine practice to what we call now a direct primary care practice. So it's a slightly different model. It's a monthly subscription type thing, but it's not a concierge type practice. So, but what it allows me to do is it allows me to spend time and truly sit down and talk to my patients about nutrition, about health and wellness, and how to go from being on 5 different medications down to maybe 1 or 2, and and get their wellness from the inside out, and being beautiful from the inside out. So that's it.
Well, excellent. And in this, so you actually went through a transition of traditionally seeing patients for 5 minutes or 8 minutes to spending more time with them. And
absolutely. Absolutely. So that's the whole idea about the direct primary care model is to, cut out the middleman, which is the insurance companies, the Medicare, Medicaid type thing, and just be the doctor and the patient. That's it. So in the room when we sit down, there's the doctor and the patient. There's no insurance guy sitting in the room telling me what to do. So, but that's the nice thing.
So how did you, I'd like to focus more on that, but at the beginning here, tell us about this journey into HCA and how did you get introduced to the scanner? What happened? I mean, you've endorsed it in all of your life, but what's everybody wants to know what happened here?
So one of the hardest thing that a doctor have to talk to their patient about is about nutrition. And, before I was introduced to the scanner, I can tell my patient, hey, you got to eat better, you got to take vitamins, you got to take this, that, and the other. But there was no way that I can quantify that or any way to show that, hey, this is good, bad, or not. So when I was at A4M, I was introduced to, or actually I was grabbed and scanned by by Laura Curdy. And so anyway, so that's how, I got introduced to that. And at first I thought it was like, there's no way this thing can be real. There's no way you can measure antioxidant that fast and there's no blood work involved. And then John Whitaker was the one that sat down and said, hey, you know what? Here are some studies you need to look at. And so, of course, me being a doc, I just said, I'm going to read this. And after about the third or the fourth readings, I'm thinking, and the white paper was absolutely amazing. And so after reading that, came back and I went to Provo and did the first, I guess the first weekend in Provo, and that just blew me away. I cannot emphasize how important that Provo trip was for me. Not only do I get to meet all of these different healthcare providers that are in the same mindset, but also met the leadership and get a great tour of the facilities and learn about the 6S process. And I mean, that just blew me away on how much Nu Skin Pharmanex has spent on research and spent on, providing a product that just blows me away. Oh, but I'm sorry, go ahead, Ken.
No, I want to hear more about that because it seemed like you connected with the leaders, and what was that connection on?
Well, the first time I was out there, at that point, I was a speaker for a branded pharmaceutical omega-3. And one of the PhD that was talking to us that day was talking about the omega-3 that Nu Skin Pharmanex has. She blew me away. I thought I knew omega-3, but she really put me in my place and blew me away. So after that, I'm like, okay, all right, they got something good here, So, but the connection to all the leadership out there was just amazing. It's everyone is helping everyone. It's not like, oh, I got this little secret and I'm not telling you about it, but everyone is trying to help everyone to succeed. One of the famous quote that I always get is, this is a team sport. So I love that.
I do too. And so let me understand, you were there and compensated by another company. Is that right?
No. The first time I went out to Provo?
No, to the A4M, to the anti-aging convention.
Medical. Oh, no, I was out there just to learn things.
Okay.
I do that pretty much every year.
Excellent. And so what happened there? Did you talk to John Whitaker and Laura Curdy? I mean, how did they get you to come out to our healthcare forum or what was the next step?
So the next step is actually Laura Curdy came to Atlanta and came to my office. She talked to one of my nurse practitioners who really liked the scanner and the vitamins and all that. So actually my nurse practitioner signed up before I did. And so when Laura Curdy came out to the office and she, we were just talking and she said, hey, let me measure you and see what your antioxidant level is. And I said, okay, I take good vitamins and, I thought I was doing good. And my initial score was 28,000. I thought I was going to fall on the floor and die right there because, here I am telling my patients to do this, that, and the other, and I can't get my score up above 50,000. And so I told Laura, I said, I'm going to take the vitamins that I have in-house at that point. It was pretty high, high grade brand. It's orthomolecular vitamins. So a month later, she came back and I remeasured and I went from 28,000 to about 33,000. I was not happy with that. And I was introduced to this thing. I don't know if you guys can see this little packet. It's called Life Pack Nano. I was introduced to that thing and took that for a month. Went from 33,000 to 55,000 in a month. And after that, I'm like, I'm sold. I'm in. And John Whitaker came in and he said, hey, we have a forum in Provo, and you want to come? And I said, okay, when is it? And he said, in about 2 weeks. Right then and there, I went in, bought tickets, and booked a room, and off I go. That was it.
Wow. And so it sounds to me like you got scanned. You talked to clinicians and people that you bonded with about being authentic. Is that right?
Absolutely.
Okay. And I know that you and John have a great personal and professional relationship. And then you came out to see the company, the science, and the team, and that was positive.
Very.
Okay. And then you had, and at the same time, you had a personal product experience, which is the process we teach. So I didn't know about the personal product experience because you were already on some great products.
Right. Well, I thought I was anyway.
Yeah. Yeah. You know, they're presented like that anyway. MD only and all that kind of thing. So it's it's the same steps we teach. And then you ordered your scanner package, you got your scanner. Is that right? What happened then?
Yep. So I ordered the package. Luckily, John and Laura was in town for when it came. Actually, it wasn't luck. They said it's going to be there on whatever date it was. We're going to be there to help you, integrate it into your office. And I'm thinking, wow, I've never had anyone, help me with that before. So it was a great experience. They came. They taught my front desk person. They taught my nurses. They taught me. John Whitaker and I had a chance to sit down and he really taught me about the scanner, about the product, about the different compensation plan. I mean, just a whole lot of stuff. But one of the main things he always tells me is that you've got to come out to Provo at least once, if not twice or 3 times. So and that's one of the things that I did is I went out to Provo, and that's where I guess that's where it solidified all of these different things in my head about the science, the products, and all that.
So I know John Whitaker and Stephen Moore and Lawrence Cassini. They talk about going to offices that are significant, people that they connected with and understand our preventative approach. And so because you had a great integration into your practice, which is the key to everything. And we're posting, we're providing teachings and educations in lieu of our healthcare forum. So tell us about what happened when these educators that we work, these leaders, were at your office, and then what happened over the next 30 days?
So one of the biggest things that I found is that the doctor or the nurse practitioner, whoever the healthcare provider is, has to be the one that sit down with the patient and talk to the patient and talk to the patient about nutrition, about antioxidant score, about how to improve the antioxidant. So that is one of the main things I do. If they just delegate that to a front desk person or a or a medical assistant or whatever, it doesn't work like that. The medical assistant or the nurse can scan, but it is the healthcare provider that has to sit down and talk to the patient about that. And literally, it doesn't take me very long to talk to the patient about, hey, your score is 28,000. This is what you need. And I just recommend, LifePak Nano or LifePak, whichever way, that conversation flow.
Dr. Wu, you were just reading my mind, actually. I was just going to ask you about that conversation with the patient. And this is such a good point that you're making. And, as we were prepping for the call yesterday, Kent and I were just sharing that it's not always the experience that we have with doctors. Sometimes they overcomplicate it and just simplifying the process. So yesterday, I love what you shared. You talk to them very simple terms so they understand it, right?
Right. So basically, the first question I usually ask is, do you know what antioxidants are? And most of them say, yeah, it's in blueberries. And that's the only thing they'll tell me. And my short quip on that is that, yes, it is in blueberries, but there's more to it. So antioxidants are basically, they're the good guys on the inside that help boost your immune system, which is, in these days, that's what you want. To help your body repair itself, reduce your risk for heart disease and diabetic complications and so on. And the reason you take vitamins and eat fruit and vegetables is to raise your antioxidant score. So, if you score 50,000 or higher, you got plenty of antioxidant, you're doing great, keep doing what you're doing. But if you score below 50,000, then basically you suck like the rest of us. And so this is what you need to take. So you score 28,000, LifePak Nano is what I recommend. So let me sit down and get some information from you and let me put you on LifePak Nano. And that's how I usually do it.
So what happened?
And do you ever get any push? Oh, sorry, go ahead, Kent.
No, that's fine.
Go ahead, my friend.
I wanted to make sure that everybody heard about your first month using the scanner.
Oh, okay.
Yeah.
So the first month when I got the scanner, I can't remember how many people I scanned, 100 something people, or I can't even remember what my exact numbers were, but literally the way that it was integrated into the office was so easy and so fast. When a patient check in, I have a little, a short letter just saying, hey, Dr. Vu is very concerned about nutrition, and we have a way to measure antioxidant. At that time, I was charging $20 a scan. And would you like to have a scan today, or would you like to talk to Dr. Vu? And usually they would say, oh, go ahead and get my scan. So my nurse would take them back, do the vital signs, scan them, have the number ready for me. When I walk into the door, I already know what their score is. So after we take care of all the other, hypertension, diabetes, whatever, then we talk about the scan. And I would say, hey, you scored 30,000. It's very low. Let's get you started on something that'll bring that up. And let's bring you back in 60 days or 90 days, and let's rescan you. And let's see where you are. But that whole process was very smooth, very easy. Didn't take me, like I said, didn't take me more than 5 minutes to do it.
So did you put on like 5 people that first month on product, or?
Oh God, more than that. Good gracious, I can't remember how many people I put on. I know I scanned a bunch, and I think I put on, I don't even remember, maybe 80, 100 people or so on products. Probably more, but I don't remember the exact number. But it was a lot.
and you are used by John Whitaker and others as a great example of integrating it into a practice and having a very successful, focused business with the scanner and products because you understand, believe, and integrated properly. So Wendy, I'll let you take over for the last bit, but my last question before that is, many doctors want to be able to have the practice you do. They want to be able to move away from insurance to cash base and functional medicine, but they have this mental block. And you've succeeded in something everybody wants. So what is it that what happened here that's different with you?
Well, I think once you're sick and tired of how to practice medicine under the thumb of the insurance company, you're going to step out on your own and do something crazy like direct primary care and just cut out the middleman and go straight to the patient and just, have a direct relationship with the patient. And I can tell you that the patients are more than happy to pay a physician to take care of them and look at them as in a person, not as in, oh, you're another copay. So spending time with the patient is much more beneficial at that point.
So Wendy,
Yeah.
you can take it from here.
Yeah. So, all righty. Thank you, Kent. This has been wonderful. We're getting some great comments. I was just curious, Dr. Vu, with LifePak Nano, some people may consider it to be a bit expensive. And how do you handle that with your patients? What do you say to them if they can't afford it, Dr. Vu?
So I have two ways to do that. So the first one is I usually ask them, what is the most expensive car that you can think of? And they're all sitting there thinking Lamborghini, they're thinking Rolls Royce, they're thinking, Mercedes, so on and so forth. And so I said, you know what? All those are pretty expensive, but I tell you what, the most expensive car is the car that doesn't work. So what that means is that, you can buy the cheapest vitamin, but that turns out to be more expensive in the long run because number one, it didn't work for you. Number two, it didn't help you with anything in the prevention side or in the health and wellness side. Okay. So that's one way that I would do that. The second way that I usually do it, I would approach them. I'll say, hey, vitamins can range from very cheap to very expensive, but you know what? We have a solution for that. We have a way that you can get, good vitamins at $2 a day. You can get vitamins at $3 a day or $5 a day. Where is it in your budget that you can afford this? And so they'll say, oh, I can afford $3 a day, or I can afford $5 a day. And that's how I get them into different levels of LifePak.
I love it. Just breaking it down so simple for them and finding out what they're willing to budget for their health. It's so simple. Well, and are there any, whoops, let me see. As people come on, I thought they were muted. I was going to say, any other questions you have, and then I can go to the chat and see what's going on in there. I've really enjoyed this. I've learned a ton this morning.
So the reason we had you on is that you're very successful in all these areas. You've transitioned from insurance pay to cash pay, using the scanner as an instrument in that process. And you're in the heartland of insurance. And yet here you are, very successfully transitioning. And I think that the lessons I've learned this morning are the importance of leadership, because it sounds to me like if Laura Curdy and John Whitaker and the Healthcare Forum, and you talked about the team, and all of this was not present, would you have integrated the scanner or any of that?
I think I would have a lot of trouble if I did not have all of those support, if I didn't have a team to help me with integrations and just learning about the products and things like that.
And so that's
Yeah,
teachings, isn't it, Wendy?
sure is. Yeah, it's, this is really what Kent and I and the leadership team, we really do talk about, and it's just all following the 6 phases of duplication that's taught right there, in Provo. And one of the key things that I'm taking away from this is it's just a good reminder to keep it really simple. When we complicate things, then we tend to lose people, and you've kept it really, really simple, Dr. Vu. So, all right. Well, let me see what's coming on in the chat. I've got a good morning. Let me put my glasses on here. Let's see. We've got a lot of good mornings. Good mornings. Thank you for being on the call, Dr. Vu. That comes from Deb. Deb, I think we got your question answered about the ADRs. And then being coachable is everything. That's from Deb as well. I think from Scott, great call, Dr. John Vu, you rock. Good questions, Wendy and Kent. Paige, Jack, yes, thank you. Thank you all so much. And let's see, I am an RN case manager, and reimbursements are bad, but doctors keep on trudging and passing penalties for readmits.
So I'd like, Wendy, the interesting thing is that people that are on this that are not leaders trying to learn how to move into this space that's growing, Dr. Vu, want to know, well, there's no healthcare forum to fly over to and learn, but have you noticed the leadership is putting on our HCA private Facebook page and other trainings that can supplement and handle the vacuum made by the inability to travel? So have you seen some of those presentations?
I have not seen the presentations just yet, but I can tell you, I'm just amazed at what you and Wendy and John Whitaker and all of you guys in the leadership position. It's one of those, you overcome the difficulties, you conquer and overcome. Hey, we can't go to Provo. Let's put some on the internet or on Facebook or YouTube or whatever. And you guys just amazing to me. So I'm really grateful for that.
Yes, I wanted to make Wendy and I got that across, that we have replaced the healthcare forum with substantial amount of education. Isn't that right, Wendy?
Yeah, for sure. Yep, absolutely. So we got a couple other comments coming in. This is great from Martin. This is a great medical model to build wellness in patients. I think we'd all agree with that. And Rebecca, and I can't pronounce the last name, I'm not even going to try. Thank you, Dr. Vu. You brought light on this, and I'm ready to get this in the Midwest, including myself with high cholesterol. Yes. What do you think about that, Dr. Vu?
I think that's great. I had no better time than right now, because this is when where people are looking for, not only for an improvement in their own health, but they're also looking to have a different business model to support their current situation. So this is a great time to do it.
So
Hey, Wendy.
Yeah, I would agree.
Wendy, wasn't it interesting that Dr. Vu held up a LifePak Nano packet, the #1 product that is a retention? That is such a learning right there, isn't it?
Yeah, it sure is. And I know we've been talking quite a bit about that with Diana, who's on the call as well, of the importance of that product, and I think that was the product, Kent, that got your attention as well, as far as absorption in your gut and so forth. So yeah. Yep.
Same thing. So that's, Wendy, isn't it so interesting that we're taught the Dr. Vu, I call it now the Dr. Vu process.
I love it, Kent. Yeah.
Isn't it
I
true?
think we all need to go out. We all need to find a Dr. Vu. That's what we need to do.
Yeah,
But
think
you
of
know
the
what's so
lives we
great?
can change.
You know, and then for the maybe the new people, the new farmer reps, just to speak to you from my heart, what's really nice about this, what we're doing with this is it's a partnership with doctors like Dr. Vu, because we all want to help each other, you know, and it's such a blessing. It's a little bit different than being in a pharmaceutical sales rep role, and this has really blessed my life. For sure. So we've really enjoyed this morning. So,
Hey,
Trent,
Wendy, can
anything
you hear
else?
me?
Oh, yes. I was going to say we can open it up. This is Jim Trainer.
Yeah, this is
to,
Jim
the
Trainer.
question.
I have a quick question. I'm afraid I'm going to lose the call if I try to go into comments because I'm on my phone. So, Dr. Vu, I had just one question as it pertains to how we as distributors can best manage expansion of our doctor-client businesses in terms of how to address getting them to refer to other doctors and whatnot to get them into that aspect of the business.
So one of the hardest thing for a person to get into a doctor's office is to, is to get past that front desk person, or to get the doctors to just take 5 minutes to listen. I know that when I'm running around busy like crazy, if you come in and say, hey, I've got this new medicine and it's going to take, your staff, to do some prior authorization, blah, blah, blah. I mean, my brain just shut off right there.
Yeah.
However, if you go into a doctor's office and you get a chance to say, hey, I've got a way for you to make an extra $50,000 a year without you doing a whole lot of stuff. You know what? Ears going to perk up and say, okay, I'll give you my 5 minutes and talk to me about this thing. How do I do it? I can tell you that most doctors would be more than delighted to sit down and just say, hey, you got a way for me to make an extra 50,000 without me doing a lot of work. Make sure it's not a scam, and basically, talking to them about nutrition.
Yeah.
When I talk to other physicians or other healthcare provider, nurse practitioners, or like, what I usually say is, how do you talk to your patients about nutrition? Do you just say, hey, take a multivitamin, go down to, GNC and tell your patient to get a pack of vitamin down that way? That's insane.
Right.
Because, you're delegating your medical authority to some guy behind the counter at GNC, and that guy probably didn't make a B in biology. So, why are you doing that? So
Right.
that's attention too.
Yeah.
Okay.
Yeah, and there's a question. I think you just answered it, Dr. Vu. She said, thank you. I'm a pharmacist. Do you have any suggestions to convince my primary care physician to try? She is not open-minded to alternative ways. I love what you just said, Dr. Vu, starting with the money. Would you like to add an additional, 50,000? Is there anything else you'd like to add to that? And
yeah,
so help out?
for the pharmacist, one of the main thing is, you have a contact point with multiple physicians. I mean, I think pharmacists and pharmaceutical reps have so much potential, much more than me, because I'm stuck in the office all day, but you guys have contact points. And one of the main things that you can talk to the doctor is you can say, hey, when you get a minute, can I swing by your office and talk to you a little bit about antioxidants and nutrition for your patient? And most of them will probably say yes if you have a good relationship with the doctors. For me, in a small town, I talk to my pharmacists, multiple pharmacies, all day long. So if you get that good relationship going, you can say, hey, let me sit down and talk to you a little bit about this nutrition side for your patient. And that's how you get a foot in the door and have a good relationship and a good conversation on that.
Yes, the pharmaceutical reps really have the ability to talk with physicians, and we appreciate you. So, we have the 6 phases of duplication without rejection. And I could say, Dr. Vu, the leadership walked you through those 6 phases of, Wendy, it's what we teach every Wednesday morning. It's, getting their hand on a scanner, having them have a product experience, getting educated, and then integrating. Isn't it amazing? It's just so simple.
Yep. So simple. We are a little bit after 7 our time. Let's see. I think we've answered everything. Let's see. Dr. Vu, do you still have people who do just insurance as to clarify? Sorry, let me put my glasses on. As to clarify, some come in for nutrition with no cost and others copay. So I guess this is what they're asking is, do you still take insurance? I think that's what this question is saying.
Oh, so most of my patients have insurance, but personally in my office, I don't file for any insurance at all. So they have insurance, but they still pay me a monthly payment. Usually the monthly payment is $100 or less a month, depending on how old you are. So it's very affordable. It gives them access to me. And usually, most of my patients that I scan, I'll probably say 80, 90% of the patients I scan are going to be on product or will be on product or already on product. So once I scan them and have a chance to sit down and say, hey, your score is XYZ, let's get you on product. And that's the end of that conversation.
Excellent. Excellent. I think we've got some other comments. Awesome. You are so inspirational. Let's see. I think we've got most. Anybody else like to ask any questions? Feel free to either take your phone off mute or put in the chat. And I'm checking Facebook Live. I don't really have anything coming in there. And if not, we can wrap it up. Let's see if there's anything else. I think we're good.
So should we
All
take
right,
everybody
well,
off mute and let them think? Or?
Sure. Yeah. I mean, let's. Dr. Vu, is there anything you'd like to say as we wrap this up?
I say let's get the patient healthy. My motto is get them beautiful from the inside out and from the outside in, but it got to start from the inside out.
I love it. I love it. Thank you so much this morning. I'm going to go ahead and take the folks off mute and feel free to, there we go, unmute all.
Thanks, you guys. That was a great call. Really good. Thanks a lot.
Thank you.
You're welcome, Matt.
That was great. So much, everyone. That's great.
Thank you.
Have a great week.
Excellent.
Thanks, Dr. Wu. Thank you, guys. Good stuff.
Oh, that reminds me, everybody, please tune in and listen to Lawrence this Friday at 6:30 Pacific Standard Time. He does a leadership call also on Friday morning. So look forward to that. The same Zoom link.
Thanks,
Yeah,
Ken.
we're getting it.
Thanks,
Thank
Ken.
Yeah,
you for
thanks.
the chat.
Nice to see you.
Thanks a lot, Dr. Vu.
Okay. All right. Have a good one, everyone.
Thanks.
Thank you.
Uh-huh.
All right. Dr. Vu, I'll send you the recording as well. I'll email it to you.
Thank you, Wendy.
And thanks again for taking time this morning. We know you usually have patients this time, so we really appreciate you being on the call.
Okay.
All
Glad
right.
to.
Everybody have a great day, everybody.
All right. Bye-bye.
Bye-bye.
Bye-bye.